Imagine waking up 3 times a night to go to the bathroom, or feeling a dull ache in your lower back that just won't go away. Would you chalk it up to age? Or something much worse? Here's the scary truth. Prostate cancer is one of the deadliest cancers for men over 60, yet it often starts with symptoms so subtle they're easily dismissed. According to the American Cancer Society, about 1 in 8 men will be diagnosed with it in their lifetime. And if caught late, it can be extremely aggressive, spreading to the bones, bladder, and beyond. The worst part. Many men wait too long to see a doctor, brushing it off as just getting older. But what if that little warning sign was your only chance to catch it early? At 67, Harold never imagined that something as ordinary as sitting could be a red flag for cancer. He had always blamed the soreness in his lower back and groin on stiff chairs or a lack of stretching. But when the discomfort turned into deep, throbbing pain every time he sat for more than a few minutes, he finally visited his doctor. The diagnosis: advanced prostate cancer pressing against the nerves near his pelvis. This kind of pain, especially when you're sitting or walking, can be one of the earliest physical signs of prostate issues. The prostate gland sits just below the bladder and in front of the rectum. When it becomes enlarged due to cancer, it can start to push on surrounding nerves and tissues, especially those in the pelvic region. That pressure creates a deep, hard-to-ignore ache. Many men describe this sensation as a constant dull pain or even numbness when sitting on hard surfaces like wooden chairs or car seats. Others feel like something is pressing from inside. The key here is persistence. If the discomfort lingers for more than a few days and doesn't respond to normal remedies like cushions, posture changes, or physical therapy, it's time to talk to a urologist. Pain may not seem like an emergency, but when it starts in the lower back, hips, or groin and doesn't go away, your body could be warning you of something far more serious than old age. It was just a faint tint of pink, barely noticeable. At 72, Charles thought it might be from something he ate. Beets maybe, or dehydration. He didn't think much of it until it happened again and again. Eventually, the pink turned to red. That's when he learned the truth: prostate cancer had started to invade his urinary tract. Blood in the urine, or hematuria, is one of the more alarming signs of prostate cancer, though it usually doesn't show up until the cancer has reached a more advanced stage. Still, it can be the warning sign that saves your life if you act on it quickly. There are 2 types of hematuria: microscopic, where blood cells are only visible under a microscope during a routine urine test, and gross hematuria, where the blood is visible to the naked eye, turning urine pink, red, or even cola-colored. Even if it happens once, don't ignore it. Blood in the urine can also be caused by infections or kidney stones, but it always warrants a closer look. Doctors will usually recommend a series of tests, including a urinalysis, urine culture, PSA blood test, and possibly an ultrasound or cystoscopy to find the source. If caught early, prostate cancer is often treatable, but if ignored, cancer can spread from the prostate into the bladder, urethra, and kidneys, making treatment much more difficult. So if your urine ever looks unusual, even just once, pick up the phone and call your doctor. Ron, 69, began feeling a sharp sting every time he used the bathroom. At first, he thought it was just a mild urinary tract infection. A round of antibiotics helped for a while, but the pain kept coming back worse each time. Eventually, tests revealed the true cause: his prostate had become enlarged due to early-stage cancer pressing against the urethra. Painful or burning urination, known medically as dysuria, is a common yet often misunderstood symptom. While it's easy to blame on infection for older men, it can be a sign of urinary obstruction caused by an enlarged or cancerous prostate. When the prostate swells, it can narrow the urethra, making it hard for urine to pass. This can lead to irritation, inflammation, or even trapped urine, which raises the risk of bladder infections. All of that causes that burning, stinging feeling. The danger is in delay. Many seniors chalk it up to age or hydration. But if the burning returns again and again, especially with urgency, weak flow, or nighttime trips, it's time to see a urologist. Pain during urination isn't just uncomfortable. It could be your prostate sending you an urgent message. When Sam, a retired firefighter, started feeling an ache in his lower back, he thought it was from old injuries or lifting his grandkids. But the pain didn't go away, it got worse. It spread to his hips, then down his thighs. The scans told a different story. Prostate cancer had spread to his bones. Back, hip, or leg pain is often overlooked as part of aging, But in men over 60, especially those with persistent deep or worsening pain, it can be a sign that prostate cancer has metastasized to the bones. This is a common route for advanced prostate cancer. Once it leaves the prostate gland, cancer cells often travel to the spine, pelvis, and femurs, where they start breaking down healthy bone tissue and triggering inflammation. What sets this pain apart? It doesn't respond to rest or typical pain relievers. It often worsens at night or after lying down. It may be accompanied by leg weakness, tingling, or difficulty walking. If you've been told your pain is from arthritis or a pinched nerve, but treatments aren't working, ask for a deeper look. A bone scan, MRI, or PSA test could reveal what's really going on. Don't assume all pain is harmless just because it's common. Sometimes the body's loudest warnings come in the quiet form of daily aches. Walter, 74, used to laugh about his frequent bathroom runs. But it stopped being funny when he started leaking before he could even reach the toilet. Embarrassed, he stopped going out, avoided long drives, and even skipped family gatherings. When he finally saw a doctor, the truth was sobering. An undiagnosed prostate tumor had begun interfering with his bladder control. Urinary incontinence, or loss of bladder control, is one of the more subtle yet life-altering symptoms of prostate cancer. While it's often attributed to age or past surgeries, it can also mean the prostate has enlarged or cancer is pressing against the bladder or urethra. There are two main types of incontinence stress: incontinence, where small amounts leak out during movement, coughing, or laughing, and urge incontinence, where the need to urinate comes suddenly and forcefully. Both can be made worse by an enlarged or cancerous prostate, especially if left untreated. Even treatments for prostate cancer like radiation or surgery can temporarily impact nerves that control bladder function. If you or someone you love is experiencing changes in bladder habits, don't chalk it up to aging alone. It might be more than inconvenience. It might be a sign your body's asking for help. For Daniel, 66, intimacy had always been a joyful part of life. But recently, something changed. What used to bring comfort now brought pain, a sharp internal ache after every ejaculation. At first he said nothing, hoping it would go away. But as the discomfort grew, so did his anxiety. Eventually he got tested and found out he had early-stage prostate cancer. While not as common as other symptoms, painful ejaculation can be one of the more emotionally distressing signs of prostate issues. Only about 2-3% of men with prostate cancer experience this, but when they do, it often deeply impacts their sense of intimacy, identity, and self-worth. The pain may occur before, during, or after ejaculation and often lingers for hours. Some describe it as a dull ache deep in the pelvis. Others feel a sharp jolt that radiates outward. It's tempting to ignore such a private symptom, especially when embarrassment is involved. But painful ejaculation is not normal, especially if it happens repeatedly. If intimacy has become uncomfortable or even painful, it's not something you have to suffer through in silence. Talk to your doctor. Your health and your relationships are worth it. When Frank lost 12 pounds in a single month, he was puzzled. He hadn't changed his eating habits. No new exercise routine. No dieting. At first he was pleased, thinking it was just a lucky break. But then came fatigue, a loss of appetite, and nausea. Eventually, tests revealed what he never expected: prostate cancer. Unexplained weight loss is one of the hallmark warning signs of cancer, not just prostate cancer, but many types. When your body begins to burn through energy without explanation, it's often a signal that something is happening on a deeper systemic level. Prostate cancer can trigger changes in metabolism, decrease appetite, alter how food tastes, and even lead to muscle wasting. Men may notice they're skipping meals, feeling full too quickly, or suddenly turned off by foods they once enjoyed. While losing weight might seem like a good thing, especially if you've struggled with a few extra pounds, unintentional weight loss should always be taken seriously. If you're shedding pounds without trying, and especially if it's combined with fatigue or digestive changes, don't wait. See your doctor and ask for a full workup, including a PSA test. Your body may be giving you a quiet but urgent call for help. Bill, 71, used to sleep soundly through the night. But lately he was waking up 2, 3, sometimes 4 times to go to the bathroom. At first he thought it was just part of getting older, but the fatigue started catching up with him. He was tired every morning, frustrated. His wife noticed too. Eventually, his doctor discovered the cause: an enlarged prostate due to early-stage cancer. Frequent nighttime urination or nocturia is more than just a nuisance. It's one of the earliest signs that the prostate may be putting pressure on the bladder, either due to benign growth or cancer. The bladder can't hold as much urine when it's under pressure, so you wake up repeatedly to empty it. Over time, this interrupted sleep affects your energy, mood, and even immune function. While many seniors think nighttime trips are just part of aging, there's a big difference between once per night and 3 or more. Keeping a bladder diary can help track the pattern. If your nights are more restless than restful because of frequent urination, talk to your doctor. It might be time to check your prostate health before the problem grows quietly out of control. George, 68, found himself standing at the toilet, waiting. Sometimes it took 30 seconds just to start the stream. Other times the flow would stop midway only to start again in fits. It was frustrating, but he assumed it was just part of aging. It wasn't. His urologist later confirmed that an enlarged prostate due to early-stage cancer was the culprit. Difficulty starting or stopping urine flow is one of the most common symptoms of prostate trouble. As the prostate enlarges, it can squeeze the urethra, making it hard for urine to pass freely. Men often describe it as feeling like something is blocked or that they can't fully empty their bladder. If urination feels slow, weak, or hesitant, and especially if it leaves you feeling like you still need to go, don't ignore it. It could be one of your body's earliest warning signs. You might be wondering, am I at risk if you're over 60? The honest answer is yes. Age is the #1 risk factor for prostate cancer. But it's not the only one. If you're African American, your risk is higher. If your father, brother, or son has had prostate cancer, you're more likely to develop it too. Even family history of breast cancer, especially BRCA1 or BRCA2 gene mutations, can raise your risk. But here's the good news. Prostate cancer is highly treatable, especially when caught early. What can you do now? Eat more vegetables and fruits. They help protect your cells. Exercise regularly, at least 3 days a week. Stay at a healthy weight or talk to your doctor about a safe plan to get there. Ask about PSA screening, especially if you have risk factors. There's no shame in being cautious. There's only danger in staying silent. Your health is your legacy, not just for you, but for those who love you. So if anything in this video sounds familiar, don't wait. Call your doctor. Get the tests. Ask the questions. Prostate cancer can be quiet, but your response doesn't have to be.